Good morning and good evening to everyone. Thanks for joining today's Kanini Connect webinar. We'll start with today's Kanini Connect webinar. The topic that we are going to discuss is how telehealth is changing care delivery and increasing revenue in healthcare. Before going into our discussions, I would like to give a brief overview of what a Kanini Connect webinar series is, and then we'll get into the panel discussion. So Kanini Connect is a series of educational webinars that we are focusing in different areas, ServiceNow, data science and analytics, and then cloud platforms. So we started with ServiceNow. We had a couple of webinars in ServiceNow. The first one is like how to transform the IT experience with ServiceNow. And we had a fireside chat redefining vulnerability assessment with ServiceNow. So those are a couple of webinars focusing on the ServiceNow practice. And then we had a couple of webinars on analytics and AI. The first area of interest is like how speed and perfection is accelerating the data science area. And then we were also talking about conversational AI. How is conversational AI improving healthcare? And we had webinars on cloud enablement, how to modernize your apps with Microsoft Cloud Platforms. That was our last webinar. So in this series of webinars, today we are going to discuss about telehealth. How is telehealth improving the patient experience and care of delivery? So let me introduce our speakers here. With me, I have Dr. Avinash Kumar, is the founder of Blueprint Academia and professor of anesthesiology and critical care at Vanderbilt University Medical Center at Nashville. His Blueprint Academia deals with non-clinical experience of the healthcare organizations. And thanks, Avinash, for joining us today. And then yeah, and we have Mike Alvin. Mike is the Chief Executive Officer of Health Tech IT Solutions. He's a founding member of Gem3S Technologies, and he has extensive experience in implementing telehealth solutions. And I'm Sudha Ganesh. I'm the VP for Strategic Initiatives at Kanini. So with that introductions, we'll start with our discussion today. Once again, thanks Avinash and Mike for being speakers for today's panel discussion. Okay. So before we get into details about telehealth, how telehealth is impacting the care delivery, patient experience, and the adoption challenges with telehealth, I would like to start this discussion with what's the difference between telehealth versus telemedicine, because I believe in today's world it's being used interchangeably, but I do understand that one is the subset of the other. So, Dr. Avinash, so would you like to throw some light on what is telehealth and what is telemedicine? That would be good, helpful for us.
Absolutely, Sudha. Are you all able to hear me clearly?
Yes.
First of all, thank you so much for the opportunity to meet with you all. Thank you to Babu Krishnaswamy and the entire team from Kanini, and for putting the panel together, and Mike as well for for sharing the discussion. It's really an honor to be part of a progressive organization such as yours. So in terms of the telehealth and telemedicine, it's one of those technologies and platform that whose time has come. It's not something new. It's it's the concept has been around for decades. It's sort of like like electric cars. We've known about this for years and years and years, but finally something has changed where it's a convergence of multiple factors that has led us to a widespread implementation, widespread usage of this. And in this particular case, the accelerator was actually the entire COVID-19 pandemic that basically pushed us forward. So to basically to put it in a nutshell, when we talk about telemedicine, it is the actual delivery of patient care. So for example, if you're supposed to see somebody in clinic, that particular interaction, that particular sort of like care plan, that happens in the realm of like when we talk about traditional telemedicine per se. Telehealth is more encompassing. So yeah, when we talk about things like remote patient monitoring, say for example, so where like where you have a hub and spoke model where like you have a central monitoring system where you're watching patients from all over. When you look at mobile health, like the Internet of Things, whether you're looking at connective devices that give you information that can be used by healthcare providers in a particular way. When we look at like education, tele-education, so that's a huge thing, whether it's patient education, whether it's provider education, whether it is support staff education. So all those things, like the ancillaries to the actual patient interaction, come under like telehealth. So that simplistically putting that, that's like that's the big umbrella term. So when it's one-to-one or like when it's direct patient care issues, then it's like telemedicine. When it is like more encompassing on a larger scale, then that becomes like like the umbrella of telehealth.
Right. Okay. Thanks. Thanks for clearing that add between telehealth and telemedicine, Avinash. So I believe the one is like remote patient monitoring is more applicable for the hospice care and home-based healthcare providers, and also for the maybe for the elderly patients, like for the Medicare population, especially for the Medicare population, that's going to be really helpful. Yeah. Okay.
Absolutely. I think there are a number of things that when we look at the remote monitoring aspects of things, the applications have basically like grown exponentially over the last like year. So the sort of like proof of concepts for like this remote monitoring have been going on in the background over the last like 15 years, and now all of a sudden there's an opportunity where it can actually be more mainstream. And that's definitely what it is. There are specific applications that are like standing out more than others. And but you're absolutely right. I think like things like chronic care, where like where it's not a life and death emergency, but it's something that you can actually like slowly modify over time. Those kind of things have gotten a lot of like attention recently as well. So.
Okay, yeah, thank you. Thanks for that. So now, in fact, I remember having studied a recent study that says that like 42% of US adults, they either delayed or they avoided the in-person visits during this pandemic situation, and obviously the avoided visits are going to cost huge to the healthcare providers. So in that note, would like to hear from you, why or what makes telehealth so important to make it part of their practice for providers and for healthcare centers?
Absolutely. I think like when you look at healthcare delivery, there are multiple things that like come into the equation. The first thing is like one, to be able to provide the service. So the logistics of the pandemic, like where there were lockdowns, we were not allowed to sort of essentially like non-emergency sort of interactions were kind of like limited. Care still had to go on. And so there was a significant need for having a way where you can actually be in touch with patients. And that was the sort of like, the initial need that basically came up. The second thing was like, in terms of like, the patient, satisfaction, patient experience for them to be able to actually talk to their providers. As you know, like over a course of time, patients develop a very strong relationship with their direct healthcare providers. And that's a special relationship that transcends a lot of things. So a lot of times, like the advice they may get from other people may not have the same gravity until they've actually like heard from that from their provider. So from a provider perspective, that is definitely important. The other reason why like it was key was there was a general sort of like apprehension about coming into a hospital setting or coming into like a healthcare setting, especially where the control of like the epidemic or the pandemic was not still there, where rapid testing was not widely available or the vaccines were still not widely available. So if somebody had like concerns of like their underlying health, they didn't want to unnecessarily expose themselves to this particular environment. And that was sort of one of the other factors where people actually chose the remote sort of options. And healthcare organizations had to rapidly sort of like on the fly make changes to their delivery models to make sure that they could address the needs of like of their patients very, very quickly. And I think that was like that was commendable on part of larger organizations across the world where they actually stepped up to the challenge, because the technology pieces were there, but now it was making it available in a seamless manner was something that they really paid attention to. After the initial hiccups in like from February, March of 2020, then I think the smoothness of rollout was definitely better in the second half of the year for sure. So does that kind of answer your question?
That's right. Yeah, yeah. It answered, Avinash. I think before pandemic, it was nice to have a technology feature for the healthcare organizations, and I think this pandemic had made it must-have a technology solution for any provider, I would say.
Absolutely, because I think the like with any great idea, till you actually operationalize the idea, it just remains an idea, and there is no shortage of good ideas.
Right.
The thing that made a difference was at least in the US healthcare system, when we talk about and I'm sure this is applicable everywhere. If you're not able to, the question people always ask is, how are you going to pay for this service? So, and so is it all going to be, on why does somebody have to use this versus something else, right? So I think, where the government stepped up, where they made it equitable for getting reimbursed for for televisits, the same way if you were actually sitting in front of somebody in clinic, was a important driver to actually sort of make all the healthcare systems sort of move in that direction. Up to the onset of the pandemic, getting paid for anything tele, no matter how great the idea was challenging, and so people were less enthusiastic about trying new things, where there was a significant learning curve to new technology, using something new for the patients and everybody else, and if no one was getting paid for it. So I think that was also one of those factors. You're absolutely right.
Right. Okay. Yeah. Thanks for that. So now, my next question would be we talked about telehealth, but how does implementing telehealth help improving the patient experience and then care of delivery? Because I think most of the patients, they prefer to have easy use of technology, and then that would encourage them to avoid the hospital visits. So in your perspective, how do you think it's improving the patient experience?
Absolutely, I think there are several aspects to this. When we look at when we look at people who need healthcare services frequently, they tend to be older patient population with with maybe one or more conditions that require help on an ongoing basis. So what telehealth and the remote access does is it kind of bridges the gaps of geography and time. So if you're not living close by, so if you don't have to make the the 2 hour drive and find parking and come and find your provider and sit for another couple of hours before your appointment comes up, if they can avoid all that in a seamless manner, I think most people will take it. And especially even though when we look at healthcare systems in the US, where things are technologically they're pretty good, but you still when you first check into the hospital, to the time you actually see a physician, you're spending a significant amount of time. And so that was that's one of the primary sort of patient satisfaction issues that a lot of people will talk about. The second thing is when we talk about wait times, right? So wait times is it's a huge problem in across multiple healthcare systems. In fact, if you drive around cities Houston, Nashville, wherever else, there are billboards that tell you what the wait times for certain hospitals are. So it's that much of a problem. So you're able to bridge that as well with with a televisit or with an e-visit as well. Sometimes there are conditions, there are situations where you don't necessarily need a full one-on-one assessment, but you need somebody to actually lay eyes on you, and you can actually do a quick assessment and determine whether you need to come in or not. Very commonly, this would be for primary care conditions. Say somebody comes in with a fever, somebody comes in with a headache. You need to have you need to have someone take a look at them closely, but not necessarily bring them into the hospital to evaluate them. Or say, for example, somebody had some kind of surgery, and now it is like 3 weeks out from surgery, and the doctor just wants to make sure that everything is healed correctly. You don't necessarily need to bring them in all the time. So these are some of the applications where it's been extremely helpful in terms of patient satisfaction as well, to be able to do this. So I think these are some of the practical ways where it's been very helpful. The one thing I will tell you, one aspect that's been very helpful is in the realm of mental health. So we know that the whole pandemic has been a significant stressor on families, on individuals, and these are regular functioning individuals. So if they had underlying anything else that was going on, this was a significant precipitating factor for for stress in these individuals. So especially patients with anxiety, with depression, where the level of functioning may be problematic to start with. If you layer the pandemic on top of that, it becomes really difficult. So telehealth, was definitely an option which made the continuity of care of these this sort of subset of patients very, very helpful. And these are some of the ways where the patient experience is actually enhanced in the setting of of having this technology available.
Yeah, okay, yeah, thank you. I agree with that, absolutely. I agree with that, because especially the reduced wait times is definitely a boon when it comes to telehealth, I would say, because leaving the traffic, I think you go and wait in the hospitals during this pandemic, you get so scared. So I think that's one of the important aspect to be considered. So, Mike, would you like to add to this, like how from technology perspective, how telehealth is helping patients, and then how it helps improving the care delivery?
Definitely. There are a couple of things which I just wanted to add to what Dr. Avinash has explained here. The first thing which I wanted to touch base is it has always been a convenience of the patient when it comes to patient satisfaction getting in the picture. And telehealth has given that platform to the patient to make sure that they can do these consultations from their home. So that is first thing which has been a big boom in this pandemic and during this time where it has been grown to a very big level. The second thing is doing it without much of a complex programs and a lot of applications to be downloaded or different hardware to be done is another big thing which patients sees it as a convenience. Right at this point of time, all these platforms which is out on the market can work from their Droids and from their iPhones, which was one of the biggest convenience. And people or providers who have started to deploy technologies which was more easy for these customers without neglecting an Internet Explorer user or a user with Safari and things like that. So that was added more convenience to the patient when it comes to the technology giving more convenience to the patient.
Right. Yeah, absolutely. I agree with that. Yeah. Thanks for that, Mike. So now we discussed about we were discussing like what is telehealth and why telehealth is important. So in today's connected world, I would like to know how telehealth is empowering physicians and creating possibilities of international collaboration with their peer physicians and with the other hospitals. Avinash, would you like to take that?
Sure. This is, I think, a really important element that has come out of the availability and the accessibility of technology and web-based applications across the world. So when the fact that you can share data makes it incredibly powerful. That you can actually collaborate across continents. So geography doesn't become a limitation anymore. So some of the common elements where that's actually happening on a wide scale basis and with a high degree of fidelity is patient monitoring. So for example, you can have multiple intensive care units in smaller rural hospitals where you cannot really staff them 24/7 with with board certified intensivists. So what you do is you can have a central hub where you have like specialists who are capable of like taking care of these patients, who are remotely monitoring them. So the remote monitoring has been one of the practical applications of actually being able to do this across continents essentially. So there are groups that are based say in the Middle East or in India that are monitoring patients, like whether it's in the US, whether it is like in the Middle East, like in Dubai and that areas, or in Southeast Asia. So the geography doesn't necessarily become like a barrier anymore. All it requires is like is the will and the policies to be set up so that we can actually implement this. The second sort of thing where it's very, very helpful is diagnostics and like and workup of like conditions. So for example, if somebody in Boston gets a CAT scan or an MRI of the brain, you don't have to be in Boston to actually like read those like the scans. It can be done from anywhere. And that's basically been the teleradiology has been like probably one of the cutting edge groups of like physicians within healthcare that have been doing this for a long time. So nowadays, like so if you had to depend on like local workforce, and the scan was say done at like 2:00 in the morning, the cost of having like a physician at the bedside who can actually read the scans is going to be significant. Rather than that, like if you have like a remote model where it works on on a different time zone, which is much more convenient for like for the teams that are actually monitoring, they can actually like churn out reports reasonably quickly. So you at least have answers to the problem that you're dealing with in almost like in real time, in a matter of a couple of hours. So these are some of the elements where like from a patient care perspective, it's actually been like very, very helpful. The third sort of broad spectrum of possibilities has been the things about second opinions. So let us say like you have like somebody in the family has a complex medical problem that you've already gone to like 5 different physicians or hospitals, and you're not getting the answer, or you're not like sure whether you're on the right track or not, and you want an opinion from from somebody with a different skill set. So this sort of like need is definitely there in developing countries and in emerging markets, because the healthcare is not equal in a lot of these places. There are centers of excellence, but when you come to smaller town cities, whatever else, it may not have the same sort of like standards of care. So getting the ability to like get a second opinion from a board certified US physician or a UK physician or whatever else carries a lot of like weight. So that is also something that is being enabled by companies now without the limitation of geography. The other sort of like elements where it's been helpful and actually been used is in disaster medicine and in like in emergencies. So irrespective of the pandemic, like whether it's earthquakes, whether it is like the floods, whatever else it is, that impact like different parts of the world almost unequally in places that are like resource poor. Having the ability to sort of like to provide care or to provide direction from a different perspective, from a different location, where you're not sort of like bogged down by the details of like the things happening around you, is also something that has been like looked at like very, very closely. The US armed forces have been doing this very, very well. When they have like deployments across the world, where they have to like sort of like talk to physicians on the ground as well as from elsewhere. The other sort of like the secondary aspects where international collaborations have been very, very helpful with the tele is research. So when you have like development of like the new vaccines, development of like new research protocols, new cancer drugs, etc. When you're studying these, and we know that we have to look at these the efficacy of whatever the treatment is across thousands of patients. You can't just do it in like 50 patients, 100 patients, and say this works. So when those are the cases, usually it cannot be done in like or it's very difficult to do in like one institution. You got to have like multiple institutions, usually across different like time zones, across different like patient populations, because that's also important to answer the question. So let us say you come up with a medication for like for headaches, and it works only in like South Asian patient populations, and that the value of that is not there. You have to study it across like multiple populations, And health telemedicine has been very, very helpful in that particular scenarios. And obviously, and the last thing is obviously education, where the ability to sort of for transmission of knowledge across boundaries has been enabled to a tremendous extent by by telehealth telemedicine. In fact, what we are doing right now is a classic example of that.
Right, right. Yeah. I mean, thanks. Those are really good details that we are getting today, especially in the U.S. Armed Forces and yeah, in the education. I think apart from the clinical aspect, I think these are the other aspects where, I think telehealth is actually helping us in this connected world. Thanks for sharing the details, Dr. Avinash. So yeah, we discussed about reducing the cost of, I mean, having telehealth reduces the cost of doctor visits, and of course, you mentioned about post-discharge of the patients. That's further follow-ups or further visits also is reduced, and we also discussed about how this is improving the patient experience. But from the clinical or administrative perspective, how does telehealth improve the operational efficiency, and also how it impacts the cost of care delivery? Would you like to throw some light on that?
Sure, absolutely. I think this is a when you look at healthcare costs, especially in in developed economies like the US, a significant amount of the dollar, for every dollar that is spent on healthcare, a lot of it goes towards the operations itself. It's not the actual patient interaction that is that takes up the bulk of the money. There is a lot of in between costs which account for why healthcare is so expensive in the US. I mean, that's not the only reason, but it is a significant contributor. So everything that every hospital system can do to kind of contain those operational costs will be a tremendous advantage. So the things that have been dissatisfiers have always been patients not showing up, for appointments, say, for example, for whatever the reason. Maybe they didn't have transportation, they didn't have, something else, whatever it was. So telehealth, for example, by optimizing the appointment booking systems, right? So to make it a little more seamless, to give patients more control over when they want to book their appointment. Because right now, if you call into a large hospital system, whether it's Emory, whether it is Vanderbilt, whether it is Harvard, you're going to go through a decision tree of phone calls. Press this button for this, press that button, and you got to wait for some more time. And then they'll take your details, and then you'll have to wait for whatever window of time to get appointments. So this is a huge dissatisfier for patients when they have to first of all wait for 20 minutes to talk to a human being, and then it takes another period of time before they can actually get their appointments. So the infrastructure that goes along with building in tele capabilities has a lot of these things that can actually be integrated directly into it. So that is something that has been very, very helpful. The second sort of a thing, from an operational perspective, when you look at hospitals, the place where they make money or the profitable aspects of healthcare delivery is actually in procedural based sort of specialties. So again, these are patients who need procedures, who get procedures on time, and who get better without putting extra burden on the healthcare system by being chronically ill. So that's sort of the thing. So by being able to streamline patients coming through screening, triage mechanisms, and to televisits, you're able to sort of pick up much early on who you need to send towards a surgical or an interventional pathway. Rather than coming through 4 different primary care providers over 6 months and then deciding they actually needed their gallbladder surgery 6 months ago is not ideal. So having these sort of the streamlined processes and workflows, we can definitely get patients who require the care much early on rather than going through the entire system. So I think these are some of the very simple ways by which you can actually work towards improving efficiencies and improving revenues as well. So if you're able to sort of intervene early, then and prevent later complications, the investment that you make in whatever the technology that you use for the tele thing is going to pay for itself. So if you let's say, like, you delay heart surgery for whatever reason, right? Because they couldn't, like, get to the doctor, they couldn't get an appointment for 3 months, and somebody has a heart attack in between, and now they come to the hospital as an emergency, and they have bypass surgery. Now they're in the ICU, and then when you look at all the complications that come in after that, these are all compounded by the fact that, like, they couldn't get the care, not all the time, but in some situations where if we had, like, intervened on these people early in an elective manner, we possibly could have, like, held off on some of these, like, secondary complications, because this is what, like, sucks up a lot of the resources, and like, the return on like, investment on these particular kind of, like, things becomes less and less and less. So what you want to do is to intervene early, and help patients out, like, better. So when you look at it that perspective, it kind of, like, pays for itself over time. So that's sort of, like, some of the ways that you can improve your operational efficiency, I think, for healthcare systems. Again,
Okay.
this is like a simplistic way of putting it. There are, like, multiple, complexities when you actually look at it at a hospital level.
Right, right. Yeah, I think you had put it nicely in a nutshell. Like, we call, okay, maybe before we proceed further, I think we have a poll here. So for the audience, we do have a poll, so maybe you can go through that and submit it. Have you or your family members used telehealth solution for your personal needs? We would like to hear your views on this. Okay, while it's on, so Dr. Avinash, so with respect to whatever you had mentioned, so I think the shift left, we call it shift left in the software terminology, where, like, if you have the shift left process in place, if you intervene it early, I think your technical debt is going to be reduced greatly. So I think it is applicable everywhere. Unlike you mentioned about intervening early in the medical, it's definitely going to reduce the cost. So, Mike, now, would you like to add anything to this? Like, you have implemented telehealth solutions. So, post implementation, how does telehealth improves the cost of care delivery?
Definitely. So when it comes to telehealth and cost implications, I just want to give you a quick example before I start about this. So when it is telehealth being implemented, it is not Zoom which is going to be your telemedicine platform. It is not your Skype which is, or your WhatsApp to be your platform. So when it comes to a telehealth, it has to be something which is integrated in interoperable way, so that you don't have to manually bind these data back and forth. So what we have actually seen as a challenge with a lot of small and mid-level players out in the market, where they go in for a standalone telehealth platform. And the problem is they would have solved the first part of the puzzle, that is getting their patients a connection on a remote part. That is, they can connect with their patients remotely. Then comes the new problem, that is connecting it with their source of truth, which is their EMRs and EHRs. Because what we see on an average when a consultation is happening on a telemedicine platform, the consultation may take less than 5, 6, 7 minutes, and the documentation process around it takes 15 minutes. And because that is how you're going to be paid for it. And when you're going to have a platform which is half cooked, or which is not there for that particular purpose, the problem is you may be spending more than 30 minutes to complete things, because you would be doing your soap notes on your EMR, you need to do your order somewhere else, you need to go check for your eligibility somewhere else, get the claims processed, and that puts a lot of pressure over the providers, especially on the doctors who are doing this, where they have to keep spending a lot of time diagnosing patients and helping them out on to get them into a care plan. So what we have seen in many cases is that the problem arises, or the efficiency increases when they get into a connected health model, where their telehealth goes hand in hand with the technology what they have earlier, or whatever they are married to.
Okay, yeah, thanks. Yeah. So since you talked about the technology perspective, and you mentioned like telehealth is it's a holistic solution. It's not just the video conferencing alone that we are talking about. So any telehealth, when it comes to any technology implementation for business organizations, like the when it comes to like be it any technology implementation, the first and foremost concern is going to be about the data security, and especially with healthcare organizations, I think data security is the very critical aspect, right? You mentioned about EHR systems, and so any telehealth solution is going to have the integration with the EHR EMR systems. So how is data security how to ensure data security does not become a telehealth's Achilles heel, because you do have EPHIs, and then you do have to need to comply with HIPAA and HL7 and FHIR standards. So how do you think data security is taken care?
Okay. Yeah. So I would like to answer this question in two parts. So when it comes to data security, it is not just a problem for telemedicine. It's a problem for any digital business who, or any business who wants to go digital. The thing here is there is to be two sections to be done. So earlier, telemedicine was on a very small numbers, and it was very significantly low. And this COVID situation has increased the quantum of it, and telemedicine is going to stay for much more time. And it has started with telemedicine and going to be a telehealth in the very future, where it's going to be more of connected health, treating people or helping people on a remote process is what is going to be happening, just to give a better convenience for the patient, to control the cost which is involved on getting these treatments and the plans worked out for the patient. So when it comes to data security, this business is no different from any other. But here the criticality is more because it's going to involve the patient's health information. So the responsibility here is going to be put, since it is the providers who are going to be choosing over the platform, not the patients, because patients are just given an option to opt in for whatever the clinic or hospitals come up with. It is the responsibility of data security lies on two parties. One is the vendors who are going to be providing this technology, and secondly, the providers who's going to opt for this technology. So when we say about providers, the reputation of them is being put on stake when they are choosing this technology. So they have to ensure that they stick with companies or technologies or providers with whom they've been earlier working with. They have to ensure and do their own due diligence, especially with making sure that the technology falls under, make sure that they are they're compliant with the regulatory parts in the region. For example, in the US, we need to have ensure is an HIPAA compliant by at least the bare minimum. Check for whether the technology has gone, or the company has gone for SOC 2 Type 2 kind of validations, which ensures, or at least that gives you more information about what kind of controls they have, who's the custodian for the data, how are they going to treat this data, what kind of who's going to own the data. It's basically there are companies out in the market, not in the US but in different regions, where the patient data is being used for a lot of other things. So it comes to be the responsibility of the providers when it comes to when they do the due diligence here. And there are a lot of standards being set up upfront, and it is just to pick the right vendors out in the market when you go for a choose for your particular technology platform provider.
Okay, yeah, thanks for that. I agree with you. Like, especially there are many data breaches across the industry, obviously, but then when it comes to healthcare, I think that's a very important aspect. So any telehealth solution that has to be built, I think it has to take care of the secure messaging and then ensure that the EPHI and the FHIR standards are implemented. Okay. So since we discussed about the security perspective, so apart from security, maybe Dr. Avinash, I would like to throw this question to you. What are the current challenges faced by providers when trying to adopt a telehealth solution? Because we talked about how it's helping us, but in spite of that, I think there are like limitations or hesitation when it comes to adopting telehealth still. So I would like to know what are the challenges that are faced by the providers.
Sure. Actually, Mike's answer was like, really very helpful, and it's a central thing that we deal with as well. And to answer your question on the providers, barriers that we have currently, like for implementing telehealth solutions, it again depends on like your area of practice. So, for example, so if you have, so it depends on whether you have an outpatient practice, whether you have an inpatient practice, whether you have you're part of a specialty that can actually do a lot of things remotely or not. There are certain specialties that are like that are inherently where the adoption possibilities are significantly higher. The first thing is like if you are a small practice, that means if you are like independent of a hospital, you have like a group of physicians, providers, then the decision making becomes significantly different. So the kind of solutions that you're going to be looking at will be very different than say something what a hospital system would need. And in the US itself, like I'm sure like based on like the areas of growth, there are more than like 300 telehealth companies that are out there. I'm sure it's more than that, but there are at least that many as of like 2020. And there are in all stages and all sizes, like from multi-billion-dollar companies to like the startups that are like trying to address like specific needs. And the reason for that is like we don't have a one solution that fits all from a both from a physician side as well as from a practice side, from a patient side. So the other thing is like is learning new technology. So like Mike already had mentioned about like the amount of time that individuals spend on documentation. In certain healthcare systems like the US, for example, we spend a significant amount of time documenting everything, which is the way you actually get paid for like for the service that you provide. Only what's on paper is like is what really happened. So that is the sort of like dictum that people follow. You could have spent like 45 minutes talking to a patient, but if you don't like put that in your your documentation that this is what you ended up doing, you're not going to get paid for that amount of time. So there are significant like limitations in like adding on more and more methodologies or more and more platforms onto what you're already doing. At the end of the day, so you need to have something that like works quickly. So you need to have a system that basically like already talks to your your electronic medical record, whatever you use. Because nowadays with the current push from like from like the government to have like a healthcare electronic medical record, which is like which is a requirement for most practices now. Having the solution talk to that directly will be very helpful. The third sort of like hesitation is if your patient population is technology naive, like let's say these are older patients, like who are not that savvy with like with learning the new apps or whatever else it is, then getting them to use it is another problem. So we know about this, right? So there are so many apps that are available for so many things, but how often do we actually like download new apps into our own phones? And we are in this particular panel at least, like we're reasonably technologically savvy, and we want to like we want to like try new things, and we ourselves don't do it. So for older patients who have other limitations, it becomes very difficult for them to adopt these things. So I think like capital costs from a hospital side, when you look at this, especially say for example, I work in the ICUs, so I see this e-ICUs or like or remote ICUs or something that like that I'm familiar with. The capital costs of making sure that you have the monitoring systems, the camera systems, the flow of information is pretty significant upfront. And for the longest time, when you look at all the published data, there was no black and white answer to say if you do this, you're able to save X amount of money or X amount of lives. There were always groups of studies that were that showed the information saying that this was very, very helpful. There was also a bunch of studies that kind of were plus minus on the outcomes. So that's part of the reason why larger hospital systems sort of go back and forth before they can actually implement certain things. So I think to answer your question in a nutshell, it depends on the kind of practice, depends on the patient population we're looking at. But I think the threshold to try new things now because of the real world limitations is definitely lower. So people are definitely more likely to try something now than any other time in the last 10, 15 years.
Yeah. Okay. Thanks, Avinash. Right. I think because of the pandemic, they are in fact, in a way, they are forced to use this also. And so once they get started with, I mean, using any, for that matter, not only telehealth, as you said, any other apps, right? So once they start using, then they go with that. That's becoming a style of life for them, actually. Yeah, that's right. Thanks for sharing the details. So, earlier, you also mentioned about, okay, we do have the next poll. Maybe we'll take this poll and then go to our next question. So for the audience, we do have a poll flashed on the screen. You can go with that. What stage of telehealth implementation are you or your provider organization is in? And also a quick time check. We are in the last 7 minutes of our discussion. So for the benefit of audience, like if we'll have the last 5 minutes for Q&A. So if you have any questions that you would like to have verified with Avinash or with Mike, please go ahead and post your questions in the Q&A chat. Okay.
Just to add to Dr. Avinash's answer or to
Yes, Mike, please go
response,
ahead.
one thing which I practically have seen with providers as a problem is dreaming big and trying to implement all at one stage. So that has been a very big problem what I've seen, especially with telehealth, because this is a very nascent technology which is there for quite a long time. When Kentucky started with their social responsibility program for their cigarette smokers, that's when telemedicine started with their phones. And that's how it started to come into different forms, and now it is on the BOIP and things like that. But having a minimum viable approach is what is the best way to start with, so that you don't overload your users with too many things. Go on a face-by-face approach so that it helps you in a better way to get a telemedicine strategy or a telehealth strategy started for your organization.
Okay, yeah. Thanks, Mike, for adding to that. Yeah. So now we discussed about, yeah, you mentioned about the challenges and when it comes to implementation of telehealth. So that brings another question, like how to market or how to popularize this telehealth implementation for patients and for provider organizations, or in other words, like how should providers approach educating patients of maybe various complications or the age groups, because even Avinash, you mentioned that mostly maybe elderly populations may still be hesitating. So how to market or popularize this telehealth?
I can take this question initially,
Yes.
and I'll leave it to Dr. Avinash the rest of the piece. So it is your even though it's a healthcare business, it has a physical and a virtual office right this point of time. Telehealth is going to be a virtual environment. So this business should be treated the same way, just like how you have another good store. So if you have a store today, and tomorrow you're starting your online store, you should start your advertisements right from your store and not from the online, because online businesses and advertising in online is not as easy as getting conversions from your real stores. And added to that, the strategies on how to spend it is again another e-commerce market. So you have to pull in customers the same way how you have done it for your existing stores. So the way how we have seen it is converting your existing customer base to an online and keep increasing it in a very organic way would be the right approach for a longer run. There are few companies which operate 100% virtual. So for them, it is advertisements online and things like that would work fantastic. But if you're a brick and mortar setup and you wanted to do it in an organical way, you have to take one step at a time. And it is nothing different from managing your real brick and mortar setup.
Right. Yeah, I agree with you. I mean, any solution, like not only telehealth, I think there is a difference between like it can be a brick and mortar or a digital platform. So it's up to the when it comes to the adaptability, I think popularizing it as it holds good like any other applications. Right? Yeah. Okay. So would you like to add anything to this, Avinash?
Yeah, I think like
From the provider's perspective.
from a provider perspective, I think like and from a patient perspective, if you have a solution that like it ties the different elements of things together. So, for example, if I come in with a sore throat to a particular clinic, I need to be seen by a physician. They need to like write a if I require a prescription, they need to write a prescription. And then like I need to be able to if there are tests to be done like or tests to be ordered that needs to be done, and then like whatever like the payment options etc. need to be done, that also has to like happen seamlessly. So there are like 3 or 4 different things that need to happen, and I think like by having a solution that kind of like addresses all this in a seamless manner, without like multiple logins, without like 5 different like authentication methods that we have to see every single time we log into things, would make it much more feasible for like for just regular folks to like to come in and use this. Because now when I get my prescription, even though they can send it electronically to people, we have to like tell them like 20 times to where it needs to go, and then you got to go and wait there, and then like there are all these like practical things that are like that are broken in the links of like what needs to happen conceptually. So I think having a like a platform which do exist, I know, where everything is seamless, can make like adoption like significantly much more appealing to people. I think that's what I'm going to add to it, and I agree with like all the things that like Mike had said about like bigger healthcare system as well. So.
Yeah. Thanks for that. Yeah, I do agree. Like, so that's why, like, I think now many organizations have embarked on the digital transformation journey. So as part of that, like, we are seeing like all the business challenges or any problems, like from the technology implementation perspective. I think it's getting popularized nowadays. So I think that's the good for digital transformation initiatives, I would say. Yeah, with that, we come to the end of the session. So thanks, Dr. Avinash and Mike, for being with us and educating us on telehealth. It was really a very insightful session for us. And thanks for all the audience who joined us. Any further information you would like to hear from us on telehealth, please contact us at transformations@kanani.com, or do visit our website www.kanani.com for any other technological services related to this.
So I want to like say thank you, for the
Sure.
opportunity
Go ahead.
to meet all of y'all, and to meet Mike as well, and to Babu Krishnaswamy and his team. This is like a as a physician taking care of patients, this is a very different aspect of things that we get to interact with. It's been a great learning experience for me as well. I hope like the audience finds it helpful as well.
Yeah, thanks, Avinash. Yeah.
Thank you, team. Thank you, Dr. Avinash, for your time here and sharing your knowledge around telemedicine and telehealth.
Thank you so much. It was a great opportunity. Thank you so much.
Yeah.
Good
Thank
to see
you.
you.
Thanks all. Yeah. Have a good day and good evening.